Hello, everybody. I am Tony Heil, Director of Communications and Public Policy with the ALS Association Greater Philadelphia chapter. Actually,
That's you. That's not me. I closed my Outlook.
I know, it wasn't you, but it's okay.
No, okay, I just wanted to make sure.
Hello, everybody. My name is Tony Heil, Director of Communications and Public Policy with the ALS Association Greater Philadelphia chapter. And this is a special Talk to Defeat ALS video where we discuss what we've learned from the pandemic and maybe some good lessons for people with ALS, caregiving, and how ALS families may get better care through this experience and our hopes for the future. I am talking today with my good friend Alisa Brownlee, who has been with the chapter for over 20 years, providing every aspect of care, basically, especially leading our chapter's assistive technology program. And she's going to hopefully give you some good things that we can discuss in a positive fashion that we've learned from the pandemic. So thanks, Alisa. I appreciate talking with you.
You're welcome. You're welcome. You know, Tony, I think all of us learned something during the pandemic that we can do things differently.
Mm-hmm.
For many years, not just in the healthcare world, in general, employers are always like, you have to be in the building, you have to be with your coworkers. I think we found out that we can do things at home. Mm-hmm. We can work at home. But as a side effect of that, per se, we have more isolation. And this was especially impactful for our clients with ALS. They couldn't, and already ALS is a disease that causes people to remain home more. Well, now there's the pandemic, which basically said you have to stay at home. And what I saw happening is more involvement in Facebook groups, like for ALS, where people could ask specific questions. And not only, yes, they could do that through telehealth, but sometimes you didn't want to bother the doctor or the nurse, or you just had a question about, a feeding tube. And so I saw more people get together online and much more interaction in these groups than I had seen in the previous years, which makes sense because people were at home and they had questions. And then we were able, in the ALS community, we were able to say, okay, well, you still need ALS care. So we transitioned our clinics, like our Jefferson Clinic, from live to telehealth. And yes, that's challenging in itself. Mm-hmm. Of course, it's challenging for the providers who had never worked in this kind of format before, and also for the users who were new to learn Zoom or FaceTime. But we made it happen, and we still provided an exceptional level of care to our clients with ALS, even though we had to do it through video chatting. Of course, now that we're starting to open up, people are going back live, but we're still in place. Like if you say to the physician or the nurse, I really want to talk to the doctor, but I simply physically can't make it. Maybe now you don't have transportation, or you're still not comfortable going into a hospital or a facility. We still offer telehealth, and I think that is here to stay.
And one of the things that I have been thinking about throughout this is, had the pandemic happened 20 years ago, or around when you started, or 10 years ago, or even 5 years ago, our ability as a health organization would have not been there in the same way to address these needs. We're not fortunate we had a pandemic, but we're fortunate that we had the tools to adapt as quickly as we did.
Absolutely. I can't praise enough the development of technology and what it has meant for our ALS community, but also for people with disabilities. So the advent of the smartphone, and I want to say 2003, 2005, because I know the iPad came out in 2007, I think I have my dates right, opened up a whole new world for people with disabilities, and opened up possibilities for people with ALS to be able to immediately have a device like this, get on the internet, the advent of social media, the being able to FaceTime. but being able to do it through one device.
Mhm.
You know, when I started, oh my gosh, you had, you know, your laptops, which are barely sometimes even in Windows, and then you would have your digital camera, and then you would have a video recorder. So you didn't have everything all in one place, and you couldn't take a selfie and say, having a great day, you know. So I think the advent of the iPad changed the world, and especially for those with ALS, because I see people every day virtually, and 99% of them are using an iPad or a tablet.
And the tablets are now so cost effective that really, if you break a tablet, it almost is easier to just buy a new one. And
Correct.
a tablet that is under $100 today is better than a $500 tablet from a couple years ago.
Absolutely. And the other thing that I really think made a difference in our world are smart speakers.
Mm-hmm.
All right. Now, this is my Amazon Echo, but of course there's Google Home. So I'm not being biased towards one product or another. I just use Amazon in my own life. But when you have the ones that have video screens like this enabled someone who might have been in a, Alexa, stop, who might have been in a nursing home that, you know, during COVID, you couldn't have any visitors. So how did people connect, especially if they didn't have a smartphone? Well, you know, a family member could buy a smart speaker with a video. They can program it into their own phone, and then they just send the smart speaker over to the nursing home, and it gets plugged in, and the resident would say, you know, call Tony, or, you know, her name, call Tony, and they could see you on the screen, and you could see each other. So even people who were not tech savvy or didn't have access to a tablet or a smartphone were able to be connected with their families. And again, we didn't want to have to learn this lesson during the pandemic, but we did. And now people are using this tool, you know, smart speakers, for everyday use.
Mm-hmm. And so the ability to adapt right now and to make use of technology during, you know, a quick emergency, because the pandemic, one day things were normal and almost virtually the next day things were at home, is also because that technology is ubiquitous. Everyone can access it, and people had been there weren't a lot of people that we had to train on some of the basics. You'd had to train on, I didn't use Zoom before last year, for example, but for the most part, people were more tech savvy in addition to having the actual physical tech.
Absolutely. And a lot of times, if they were challenged, they could, you know, call another family member and everybody could walk through. I mean, I just, you know, today was walking through somebody on Zoom. Okay, now click the start video. Oh, okay. So it's not that hard of a platform to learn. Thankfully, it wasn't. And I think also what Zoom enabled people to do, and if it wasn't through their platform, it was through another, is participate in things they never could have before. And I say advocacy is number one for our folks. You know, going to Washington or talking to your legislature about your life story and trying to impact our government to, you know, direct more funds to ALS, whether it's research or care services. In the past, you know, you could do that through a phone call, but we had this major advocacy conference, but that means that people had to go to Washington. And so you had to have the financial means to do that. You had to have transportation. You might have to fly, and would your wheelchair be broken? So last year we had virtual advocacy, same as this year, and we had hundreds of people participate. And I think it opened up a door for people to take action that they couldn't do before.
Mm-hmm.
And I say that couldn't do before. Yes, we could, but it just wasn't mainstream.
Right.
You know, you go to a conference and you say, why isn't this streaming? Well, it's cost prohibitive of things. Well, now we know it's not. And people attended ALS conferences that they couldn't have attended before, you know, care services conferences. I've sat in on different ALS chapter conferences from Oregon to Missouri, you know, but I couldn't have done that.
Right.
Excuse me. I physically had to go.
Right. And not only that, but in addition to not being able to possibly afford or make it's hard to get on an airplane, whether a person with disability or someone else who's just someone who's connected to a cause. You don't have the time that it takes to go out to those places, because it takes a day of travel for many
Correct.
people to gather to DC or to go to those conferences across the country.
And I also think that traveling is even more compounding or confusing, because you leave your home with all your equipment and you arrive in a new city at a hotel and you don't have the same level of equipment.
Right.
Maybe something was delivered that's not correct. That's not what I ordered. What about a hospital bed? What about a Hoyer lift? So traveling in general is much more challenging when you have somebody that's so physically compromised.
Now we know that things are more equitable because of video conferencing, Zoom, telehealth, etc. People don't have to travel. People don't have to be together. But of course, people want to be together. And I think that I miss seeing people. I had a person with ALS message me saying, why haven't I seen you in so long? And I said, well, I haven't seen one person with ALS in the last year and a half. And that was just very recently because we're all vaccinated. Now, I can assume now when you would call as a caregiver, and we have a lot of people that do this, will call a hotel and say, these are my needs. Now you can video chat with them and people are more savvy to say, these are my needs. Let me show you what we need.
Absolutely. Right. Absolutely. And but you're not dealing with the hotel. Usually you're dealing with another medical equipment provider who's going to rent you the equipment. So this isn't something that insurance pays for once you get to your travel destination either, because they've already paid for what's in your home.
Right.
So it's another level of care that's involved when somebody with ALS travels. But yes, you're right. You absolutely could take a picture and say, this is the type of bed I need, or this is the type of Hoyer lift I need with this sling, and take a picture of what they're currently using. 10 years ago, was that possible? Maybe. 15? No.
And that brings me to something I wanted to bring up in terms of what you have learned, and our social workers have learned, our nurses, and doctors, etc., about the improvement of care possibly through the pandemic, of making it more accessible. I understand that for you and everyone else on our care team, in a regular day 2 years ago, if you were having a quote-unquote home visit, that might be a phone call, or you might have to spend all day going to, South Jersey, and then all day coming. You would have one visit that day. Now you and others might be working even longer days because you're doing, instead of 1 or 2 visits, maybe as much as 6. I don't know, but those visits are different now because you're seeing things in people's homes, right?
Absolutely. But inevitably, for me being virtual, you're right. I was able to see more people in one day, and I was able to serve more people with ALS than I ever did before within a given year. Because you're right, I might drive an hour, 2 hours, I see one person, whereas I can have 2, 3, 4 Zoom visits lined up in a day. So we actually provided, I think, a higher level of care when we did it virtually. The sad part of that is that you miss that one-on-one connection. That personal connection of sitting next to somebody and talking about what their needs are and showing them maybe on my iPad. I miss that. I miss that personal connection. But I also feel real good that I was able to help many more people than I normally would have if I had been on the road.
Yeah. So what are the kinds of things that you, as an assistive technology specialist, or as a social worker or a nurse, what are some of the things that you might notice by doing these virtual visits that maybe you wouldn't be able to do when you're in person at a clinic?
Yeah, it depends on how many people are partaking. I usually ask for, the person with ALS and a caregiver, and is there another family member? What I have found is that latter question, is there another family member? A lot of times that other family member lives across the country. So they could not have participated in my virtual visit before.
Right.
And I will tell you, most of my virtual visits are around home modifications, accessibility, and safety. That is crucial to a family, and like a daughter who might live in California wants to know how to keep dad safe that lives in Philadelphia. And so that she could participate in that wasn't something that could be done before. And sending an email summary is not as good as somebody sitting in and listening to what we're talking about, and then having their perspective of, Dad, last time I was there, this was my concern, so that everybody in the family, their concerns and their needs are addressed by me or whomever's on the Zoom, but that wasn't possible before. And we even have it at our clinic. Is we have an iPad that is just for people with ALS and their families at clinic. So sometimes, the person with ALS and their caregiver will be in the room, but on the iPad on Zoom is their loved one living in Montana, so that they can now participate in clinic visits too. That wasn't feasible before.
And not only big distances, but you can have people from small distances. Like,
sure,
if someone has a full-time job where they're a teacher or whatever their profession is, and they want to participate, but they can't get out of work to go to a clinic visit, now they can. And I assume now that, let's say you were talking to Bob, who has ALS, and his wife, you could look there and say, oh, you have a step there. This is a really simple solution to that. Or,
absolutely,
that doorway there, this is a either expensive solution, or this is a $5 thing you could do that you wouldn't think they would have never asked that question.
Absolutely.
See it.
And I like Zoom platform because I can share my screen. So I'll be talking with somebody and I'll say, let me just share my screen with you. And I can show them the exact product or tool that I'm talking about. All right. It can be something as simple as a hinge on a door. All right. So there's something called swing away hinges, which basically takes, you replace the traditional hinges on the door with these things called swing away hinges, which I think are like $5 or $10 a piece. And what it does is that once you open the door, it actually swings the door out of the door frame, and it gives you about 1.5 to 1 3/4 extra inches. Those extra inches can be the difference between someone getting out of the door in a wheelchair and not. So, trying to describe what a swing away hinge is on the phone is really hard. Whereas I'm on Zoom, I share my screen and I show them a video and they go, oh, look at that. Because I think, assistive technology in general, people go, what is it? But they need to see it. It's visual. And so this platform, the online platform, enables me to do that. And I will say, even if before the pandemic, when I was doing a home visit, what was I doing? I was doing the same thing with my iPad. I was bringing up a screen and showing them and handing them the screen there. So I'm doing the same thing. They're just seeing it on their screen.
And I know that as we kind of adapt through this pandemic, you're not only showing them the tools, but they're kind of being trained in the kind of questions to ask now. So maybe you have, as you would say, an educated patient or educated consumer the next time they come to an in-person clinic, because people are smart. It doesn't mean they're not intelligent, but people don't know what questions to ask anytime. I wouldn't. And I've been here for 10 years and you've been here for 20 years. There's still questions you wouldn't know to ask. And now you will have different things you'll bring up than you may have in a different situation.
Absolutely. And I think that's our job as education. But you're right. People don't know what to ask. So being able to provide those tools, social work visits and Gail doing mental health visits and me doing all this throughout the past year has enabled our families that when they either had telehealth or now are live in clinic, these are the questions I need answered by my doctor or my research team.
So we've learned, one, that we were in better shape to address this pandemic and our patients than we would have been years ago. We also learned, two, that we could also provide really good care despite of or because of the changes regarding the COVID. Now we're in a situation where thankfully people are getting vaccinated. We're going back to in-person events. We're going back to in-person, clinic visits, etc. Things are improving in terms of that. What are some of the things that you hope people will learn? Because a lot of people say, get back to normal, but normal, we shouldn't just go backwards. We should learn from this and improve. What are some things you hope that we can continue or improve upon for the future?
I do hope that we can continue doing virtual visits.
Mm-hmm.
I think that it's not only just based on the person with ALS and their comfort level, it's based on the practitioner's level, or the therapist level or comfort level of coming out to a home. But besides that, tapping into people that we necessarily might not have been able to serve, especially like for me, I'm the only assistive technologist on staff, so I covered the entire geographic region.
Mm-hmm.
And, for me to be able to see somebody up in the Poconos or in Williamsport, it wasn't feasible for me to get in my car and drive in one day. It would be, 3 hours back. I mean, it's a full day.
Mm-hmm. Yeah. So
our territory is so large. Now I feel like I can reach those people in Southern Delaware, and I have.
Mm-hmm.
That's not an easy drive for me.
Right.
And, fiscally, the chapter was paying for mileage and wear and tear on my car. Well, now we don't have to.
Mm-hmm.
So, it just makes more sense for everyone to have the opportunity of a virtual visit. And again, I say, that could also be for clinic. Maybe your caregiver is sick. Maybe you don't have a caregiver, but you still want to connect to your doctor. So we know that I really firmly believe these platforms are here to stay. I'm not going to say it was, and when we were in lockdown, this was the only way.
Right.
Well, now, no, there's going to be multiple ways to connect.
And I think that's really important too, because if you did go to someone in Rehoboth Beach, or you did manage to go to someone in Scranton, for example, or southern New Jersey, which is hours away from your home, and for some reason that day they weren't feeling well, and suddenly it's a waste of a trip potentially, or their internet's not working. So what you would do is not as helpful. Now you can easily reschedule if you're virtual as well. If you say, well, I can't meet today, I can meet tomorrow.
Yeah, and it's happened multiple times. I'm on my way somewhere and I get a call, you know what? They're not feeling well. They fell last night. They're in the hospital. So you're right. Rescheduling is much easier on electronic platform. We just say, okay, what other day works for you?
Right. So one final thing we also learned through this, that people who are able-bodied, who do not have physical disabilities, may have now had greater attention to the lives of people who have a disability, whether it is breathing, since this is a respiratory disease, walking, getting through places. Are there any things that you hope, whether it is through advocacy, whether it's just through public awareness, that maybe we can make improvements on for people with ALS and other disabilities or diseases, to make the world more accessible to them beyond just that they can get on Zoom?
I would want every major conference, advocacy, clinical conference, I want everything to be streamed.
Mm-hmm.
Because you shouldn't have to physically have to go to learn about this disease. And, if it's not live streamed, then it's recorded and it's uploaded onto a website. Everybody with ALS should have access to knowledge, and it shouldn't just be based on you physically have to come to a meeting.
Mm-hmm. And I think hopefully as well, even if you are there physically, we've spent this year creating a different level of empathy where we're asking questions beforehand. That's one of your big things, is beyond the expensive equipment, those beginning questions at the start of a diagnosis, right? And how you ask questions to talk to somebody.
Yeah, absolutely.
Well, if you have any questions and you're listening to this or watching, and you want to learn more about ALS, support our mission, support the work that people like Alisa do, see your emails at the bottom of the screen. Please donate or learn more at alsphiladelphia.org. And of course, follow us on social media, Facebook, Twitter, Instagram, YouTube, all at ALS Philadelphia. And Alisa, they can also follow you on Twitter. You're very active there to answer assistive technology questions, right?
Yes, I'm on Twitter. It's ALS Assistive Tech, TEC. I'm also on Facebook. It's my whole name, Alisa Brownlee, with ALS afterwards. And I wanted to also just mention to anybody watching or listening who might not know what I do for the chapter, if you don't mind, Tony, I just want to.
Yes, please. Oh no, she froze there. Uh-oh. And Alisa, you wanted to just give a little bit of update background on what you do and some of the groups maybe you are part of as well.
Yes, absolutely. I'm the assistive technology specialist for the chapter. So my areas are computer access, communication, environmental controls, and I'm also certified in home modifications. And that's where I spend the bulk of my time, virtually walking through somebody's home to address, exiting and entering, bathroom issues, stair issues, you name it, we address it. And this is a free service that we offer from the chapter. And I really do focus not only just on accessibility, but on safety for both the person with ALS and their caregivers. But also I do communication. If you have any questions about communication, you're struggling with communication, please reach out to me. It's Alisa, ALISA, at alsphiladelphia.org. Or if you're interested in a Zoom virtual visit for home modifications, please email me also.
And I do want to bring up one other thing, because I know you were very involved in some Facebook groups.
Yeah.
Which have been very useful this year for people loaning equipment, for people asking questions, finding out where they can get resources. If you do get information on Facebook, it's always best to find a verified source. Absolutely. Which could be through Facebook, it could be you responding or someone else, but double check and make sure that if you're on social media, you're getting a good source from your own neurologist or social worker, etc.
Yes. And one of the things, just as a plug for our chapter, one of the things that we started last year was an equipment donation and/or selling page. And it's under the ALS Association Greater Philadelphia Chapter equipment donation page. You can do a quick search for that. But it's a way to say, I have a fully electric hospital bed. Does anyone want it? And people can offer it for free or they can ask money. But it's a way for our local folks to be able to either put equipment out that they want to get rid of or request equipment that they're looking for, especially those that are not funded under insurance. So if somebody wants to donate an electric Hoyer lift, great. And they'll say, where are you? I'm going to come pick it up.
And that's really helpful, because before people would ask if we could take it. Absolutely. We didn't have a place to put something, so we might have to turn someone down or even ask another charity organization around here if they could use it. Now we cut out the middleman aside from us connecting people, and people can get the resources more quickly than before.
Absolutely. And I'm going to say a plug this too. We're the only chapter in the country to have this.
For now, and hopefully we'll follow our lead as we have before. Thank you, Alisa. I really appreciate it. Again, find more information, including how to contact Alisa or other social workers or nurses from our chapter, all at alsphiladelphia.org. The pandemic may have changed, but our commitment to ALS has not, and we will continue to do everything we can to support our ALS families.
Well, thank you, Tony.